welcome to another episode of the Brand New Danny. My name is Danny, and I wanted to talk to you today about my experience with top surgery. And more specifically, my choice to recover from top surgery without any narcotic pain meds. I have struggled with substances in the past. I've been in recovery. I've had long-term recovery. I've had short-term recovery. I've relapsed. Now I'm finally at a point in my life where I'm really happy, really happy and really stable in not using substances. Things are a lot different for me now, and I'm living much more authentically. And so that's my point, and I didn't want to sacrifice that. I knew going through surgery was going to be a big deal, and so this was all new, and I was willing to undergo some self-experimentation to hopefully help others. I'm going to show you a day-by-day timeline and some other timeline landmarks to show you how my experience went and what I was doing at that point after surgery to help with my recovery. So I've got some pictures to show you, and then also a little bit about what I could do with my body at different points. I did a lot of watching YouTube videos before my surgery to help me know what to expect. So this is a different perspective for you. So there's me getting ready to go into surgery wearing this awesome hat. And I also use some tuning forks. I'll explain those a little bit later to help balance and relax me before I went under anesthesia. And then right here we've got me home from the hospital with the drains in, as you can see, and the binder on. And that would be where I would stay for the next 7 days. And then day 3, using the breath work and using the rhythm, the tapping. What that means is I was doing exercises with slowing my breathing down, using tuning forks, which emit sound at certain frequencies to help with relaxing, and using some tapping, not on my chest, tapping relaxation exercises that utilize rhythm, and that was helping me tons to get through stuff. Food and herbs for healing. My sweet and lovely partner made me this tea, this wonderful healing tea that was full of all kinds of herbs to aid with that. So that was really, really good. I slept finally, I think it was, the 4th night after surgery. I finally slept for what I consider a whole night. And it was my first night that I didn't take any pain medication. The pain medication that they did give me was Toradol. It's a non-narcotic. Toradol, sort of like a really strong ibuprofen. Day 5, you can see I'm looking pretty rough there. I was trying to kind of act tough. It was hot. I was sweaty. It was the middle of summer, and the binder and just the pain, and it was rough. And you can see it in my face there. So the reality check. I was not going to give up on the techniques that I had learned because I really wanted to see if these would work. So then I got my drains out. You go to get your drains out, the big reveal, apparently I got a milkshake. I don't know. Was I stress eating? Maybe. So there is the first photo that I took after my first shower, which was an ordeal. There's some bruising, but not much from some of the other photos that I had seen. And I'll explain why I think that is in a moment. So almost passed out post-shower. So this was hard. This was the first time that I had water running over these incisions, places where water had never been before, if you think about that. And it was, I was overwhelmed. Again, there's that word, overwhelming. And you have to put ointment on the scars after you shower. And I just couldn't bring myself to like move my skin in that place. And it was very hard. And I did have a good bit of anxiety about that and because of that, and had to go right into my tapping, breathing, and humming and relaxation exercises, and they worked. They helped with the anxiety, they helped with the pain quite reliably. So here's a couple of things that I was taking, and like I said, I took the Toradol for a couple of days. The heavy hitters here, and this is why I think I didn't have a lot of bruising and swelling: bromelain and arnica. The literature on bromelain is that it supports wound healing, it's anti-inflammatory. The arnica reduces surgical shock, minimizes bleeding, lessens post-operative pain, bruising, and swelling, decreases healing time, and it is an anti-inflammatory. This is a homeopathic remedy. The tuning forks. This is a picture of the tuning forks that I used in the OR right before I went under anesthesia, and then subsequently thereafter for any time I would start to get stressed out. These really, really helped balance me. So they said I couldn't drum. They were right. I shouldn't have been drumming. I had to find a way, so I decided that I would paint. I discovered that drumming hurt when I actually did try to do it, and I wasn't ready to do it. And I should have listened and taken it a little bit easier in those first few weeks. So there's my chest, not fresh off of surgery. You can see the marks from the surgeon are gone. 3 weeks. I was walking, just finally allowed to take longer walks. Walking really, really helped me through the process. I got back on the bike in a couple more weeks after that. It was about almost 6 weeks, and I took my first decently long bike ride. And then here I am with the compression shirt that I was riding in. The compression shirt helped so much when going back to the gym, getting back on the bike, just being more active in general. Having something not binding you, but just kind of holding, really was comforting and helped me be more confident and not feel like stuff was gonna be moving around too much. And then here's another photo of the healing process. I think that was about a month after. And the doctors told me that your scars would actually look pretty good, and then they would get worse again after that couple month mark, and then start to gradually fade out over the years after that. And that's honestly exactly what happened. They looked good, and then they did get a little bit redder when they started to go through a different phase of healing. So I'm glad that they told me that, and I was prepared for that, so it didn't freak me out. And then finally, this one's really important to me. Before surgery, I had started working on handstands. I am a little bit impressed that at 7 weeks, I was able to do that. I did everything I was supposed to do. I didn't lift anything over 10 pounds in the, first month, and I really did a good job keeping up on walking, hydrating, taking lots of vitamin C, using the sound therapy to reduce the stress and anxiety and reduce the amount of cortisol that was getting produced in my body, and bringing my body back to the optimal state that it could be in for healing, I think really allowed me to do this and allowed me to get back on the bike, starting out with walking and then cycling and then getting back into the gym. I'm just so grateful that I was able to do this and that my body could do this, and that I could teach myself that I didn't need drugs to get through it. Everything that I needed to heal was already built in. I'm so glad that I could get through this and maintain my sobriety. So if you are struggling with an addiction, or the fear around taking a medication, even if it is prescribed by a doctor, if you're just struggling with that fear, I want you to know that there's always another way, and we need to learn how to advocate for ourselves as patients. There's never just one way, and if you're feeling stuck or something in your gut doesn't feel right, I hope that you can find a way to reach out and get some support. Because if it's going to threaten sobriety for you, and that is important for you to maintain a happy, healthy lifestyle, I think that you deserve to protect that. Real important, I am not a doctor. I am sharing with you my own experience, the choices that I made. I cannot recommend those to you at all, and I don't. I recommend that you talk to your doctor if you are having surgery, if you're thinking about surgery, and if you're thinking about doing this without narcotics. I think that's great, and I think that that's something that you should talk to your doctor about. It could be possible for you. That was my whole point with self-experimentation, just to prove that it was possible, and prove that not only was it possible, that it could actually be great, that I could actually have an excellent recovery, not just a mediocre one. So for me, it worked, and I highly encourage you, if you're thinking about it, to speak to the professionals in your life that can help guide you. Lots of factors go into that. How much support do you have? What kind of state of mind are you in? Are you just generally a positive person? Are you extra sensitive to pain? There are lots of factors and variables that could steer that one way or another once you get into it. So you need to make sure that you're well prepared, that you have everything you need kind of around you and in place before you go into it, and that you also have your doctor's recommendation that that's the right course of treatment for you.